Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people with lumbar spine stenosis. Lumbar spinal stenosis, tip number 1. Know when to suspect that you have lumbar spinal stenosis. Lower back pain is a very common problem in the US and actually all over the world. But there are specific qualities about lumbar spinal stenosis that you should be aware of if you have low back pain. So, lumbar spinal stenosis typically occurs in people who are over age 65. There's usually low back pain as well as leg pain, weakness, or numbness. And the pain usually occurs when you're standing and when you're walking, and is usually relieved by bending forward or by sitting. So know when to suspect that you might have lumbar spinal stenosis. That's tip number 1. Tip number 2. If you suspect that you have lumbar spinal stenosis, then see your doctor. It's important for your doctor to rule out other more serious causes of low back pain. And usually, in addition to a physical exam, your doctor will order a MRI, which will take pictures of your lower back to make sure that you do have lumbar spinal stenosis. Tip number 3. If you are diagnosed with lumbar spinal stenosis, remain active. The worst thing that you can do when you have lumbar spinal stenosis is to stay in bed. It'll only get worse. Tip number 4. Specifically, aerobic exercise should be done for 30 minutes a day every day. This is a recommendation for all adults, not just people with lumbar spinal stenosis. And aerobic exercise is anything that increases your breathing rate, and it should be done for at least 30 minutes. So you should be doing at least 30 minutes, and this can be walking every day. However, with people with lumbar spinal stenosis, often bicycling and aquatic exercises are easier to do than walking because you're able to bend forward and there's less pressure on your spine. Tip number 5, weight loss. Extra weight, especially in your stomach area, pulls on your spine and makes lumbar spinal stenosis worse. So you should check your body mass index by Googling a BMI calculator, putting in your height and weight, and seeing your BMI. Your BMI should be between 18.5 and 24.9. If you're not sure how to do this, then ask your doctor what your BMI is. And the best way to lose weight is to cut back on calories. Tip number 6, don't smoke. If you smoke, it makes healing from lumbar spinal stenosis, especially when you get surgery, much slower, and also leads to worse outcomes in people with lumbar spinal stenosis. Tip number 7, physical therapy. Physical therapy with a physical therapist usually is a weekly session lasting for 6 weeks, and it will be aimed at improving your flexibility and learning exercises that you should do at home to improve your stability and your core strength. Tip number 8. If you're having an acute episode of low back pain on top of your lumbar spinal stenosis, so for acute exacerbations of lumbar spinal stenosis, it's recommended that you take analgesics such as Tylenol, ibuprofen, or naproxen for a short period of time. Ask your doctor which type of analgesic is best for you. Other therapies that have been shown to be less effective are narcotics for chronic pain and steroid injections. These are either controversial or not useful in the treatment of lumbar spinal stenosis. Tip number 9, surgery. Surgery is appropriate for people who have had an inadequate response to the above tips that I've suggested, have pain that is disabling, or have actual neurologic deficits like weakness in one of their legs, or inability to move one of their legs, or inability to feel in one of their legs. And tip number 10 is believe in yourself. Lumbar spinal stenosis is very common, and these are tips that can improve your quality of life if you do have the diagnosis of lumbar spinal stenosis. So I hope these tips have been helpful, and thank you very much for listening. Have a great day.